Welcome to www.unitedmedical.sg. United Medical specializes a complete women's healthcare service. Understanding and compassion, matched with highly developed skills and knowledge, makes us a truly distinguished practice. We specializes in fertility treatment and advanced keyhole laparoscopic surgery. We expressed a keen interest in cervical cancer screening, colposcopy, and treatment of pre-invasive cervical disease. The combination of these subspecialties allows us to personalize therapy for each patient. Fibroids are very common. About 25% of women in their childbearing years will have signs of fibroids that can be detected by a pelvic examination, although not all will experience symptoms. Cause of fibroids. Although the exact cause is unknown, the growth of fibroids seems to be related to a gene that controls cell growth. When this gene functions normally, cells grow normally. When the gene is not functioning, cells grow and divide at an accelerated rate. In this way, one cell becomes two becomes four, etc. until finally a mass of these cells or fibroid is detected. Fibroid growth is affected by the reproductive hormones estrogen and progesterone. When these hormone levels decrease at menopause, many of the symptoms of fibroids begin to resolve. Increased uterine bleeding. Fibroids may cause the menstrual bleeding to be heavier, or increase in the duration of bleeding, or may cause bleeding in between periods. Some women may have a combination of bleeding symptoms. The presence and degree of uterine bleeding is determined mainly by the location of the fibroid. Women with fibroids that protrude into the uterus are more likely to have significant increases in bleeding. Pelvic pressure and pain. Fibroids can range in size from microscopic to the size of a basketball or even larger. Larger fibroids may cause a sense of pressure and fullness in the abdomen, similar to that caused by pregnancy. Fibroids of variable sizes can cause other symptoms depending on where they are located. For example, if the fibroid is pressing on the bladder, frequent urination can occur. A fibroid that pushes on the rectum can cause constipation, and one that puts pressure on the cervix can result in painful intercourse. Infertility and miscarriage. Fibroids may cause infertility in a number of different ways. A fibroid may cause compression on the fallopian tubes, resulting in a blockage of the passage of sperm or eggs. A large fibroid may distort the pelvic anatomy sufficiently to make it difficult for the fallopian tube to capture an egg at the time of ovulation. If a fibroid protrudes into the uterine cavity or causes distortion of the uterine cavity, it may present a mechanical barrier to implantation. Some studies have suggested that fibroids in the muscle portion of the uterus may cause an alteration or reduction of blood flow to the uterine lining, making it more difficult for an implanted embryo to grow and develop. Another theory suggests that even small fibroids that grow inside of the uterine cavity may act as a foreign body and result in an inflammatory reaction that makes the uterine environment hostile for an embryo to implant. Some of these same possibilities may also increase the risk of an embryo to miscarry. Another possible cause for miscarriage is running out of space as the fetus grows. Pregnancy complications. Some studies have suggested a slightly increased risk of certain problems during pregnancy in women with very large fibroids, including difficulties with labor, breech presentation of the fetus, premature rupture of the bag of waters, and abruptioplacenta, a condition in which the placenta separates from the uterine wall during the pregnancy. These problems are more likely if the placenta is implanted over the area of the large fibroid. However, many women with fibroids have completely normal pregnancies and deliver healthy babies with no complications. What are blocked fallopian tubes? The fallopian tubes are two thin tubes, one on each side of the uterus, which help lead the mature egg from the ovaries to the uterus. A woman has blocked fallopian tubes. Tubal factor infertility occurs when an obstruction prevents the egg from traveling down the tube. This can occur on one or both sides and is the cause of infertility of about 40% of infertile women. Most women with blocked fallopian tubes may not experience any symptoms. How do blocked fallopian tubes cause infertility? When ovulation occurs each month, an egg is released from one of the ovaries. The egg travels from the ovary, through the fallopian tubes to the uterus. During intercourse, the sperm swims their way from the cervix, through the uterus, and through the fallopian tubes to get to the egg. Fertilization usually occurs as the egg is traveling through the tube. If one or both fallopian tubes are blocked, the egg cannot be fertilized, therefore preventing pregnancy. In the event of a partially blocked fallopian tube, the risk of a tubal pregnancy or ectopic pregnancy increases. What are the symptoms of blocked fallopian tubes? Women with blocked fallopian tubes rarely experience any symptoms, though a specific kind of blocked fallopian tube, hydrosalpinx, may cause lowered abdominal pain and unusual vaginal discharge. However, not every woman will have these symptoms. If you have fallopian tube blockages, kindly contact United Medical for assistance. What causes blocked fallopian tubes? Women with blocked fallopian tubes rarely experience any symptoms, though a specific kind of blocked fallopian tube, hydrosalpinx, may cause lowered abdominal pain and unusual vaginal discharge. However, not every woman will have these symptoms. The most common cause of blocked fallopian tubes is pelvic inflammatory disease (PID), a sexually transmitted disease. A history of PID or pelvic infection may also increase the risk of blocked fallopian tubes. Other potential causes of blocked fallopian tubes include current or history of an STD infection such as gonorrhea or chlamydia, history of abdominal surgery, history of uterine infection caused by an abortion or miscarriage, history of a ruptured appendix, prior surgery involving the fallopian tubes, previous ectopic pregnancy, endometriosis. How are blocked tubes diagnosed? Blocked tubes are usually diagnosed via a specialist X-ray, commonly known as hysterosalpingogram (HSG). A dye is inserted through the cervix using a tiny tube. Once the dye has been given, the doctor will take X-rays of your pelvic area. In a healthy woman, the dye will go through the uterus, through the tubes, and spill out around the ovaries and into the pelvic cavity. Should the dye not pass the tubes, the woman may have a blocked fallopian tube. However, 15% of women have a false positive, where the dye doesn't get past the uterus and into the tube. Should this happens, your doctor may repeat the test or order a different test to confirm. Other tests that can be ordered include ultrasound, hysteroscopy, or exploratory laparoscopic surgery. Blood work may be included to check for the presence of chlamydia antibodies, which would imply previous or current infection. Potential treatments: can you get pregnant with blocked fallopian tubes? Blocked tubes are usually diagnosed via a specialist X-ray, commonly known as hysterosalpingogram (HSG). If you have one open tube and are healthy, you might be able to get pregnant without much help. Our doctors may also prescribe fertility drugs to increase the chances of ovulating on the side with the open tube. However, if both tubes are blocked, you may require the following: laparoscopic surgery for blocked fallopian tubes. Laparoscopic surgery may open blocked tubes or remove scar tissue that is causing problems in some cases. However, the chances of success depends on how old you are. The younger, the better, the location and the severity of the blockage and the cause of blockage. If just a few adhesions are between the tubes and ovaries, then your chances of getting pregnant are around 20 to 40% after surgery. However, the risk of ectopic pregnancy is higher after surgery to treat tubal blockage. our doctor should closely monitor and advise you if you do get pregnant. This surgery may not be a good option for you if you have thick, multiple adhesions and scarring between your tubes and ovaries, or if you have been diagnosed with hydrosalpinx. Other reasons to forego the surgery include male infertility issues, additional fertility factors besides blocked fallopian tubes like serious problems with ovulation or advanced maternal age. In such cases, IVF treatment is your best bet. IVF for blocked fallopian tubes. IVF makes conception possible even with blocked fallopian tubes. IVF treatment involves taking fertility drugs to stimulate the ovaries, after which, an ultrasound-guided needle will be used to retrieve the eggs directly from the ovaries. In a lab, the eggs are put together with sperm from the male partner or a sperm donor for fertilization. In the event that your eggs are fertilized, we will opt for 1 or 2 healthy embryos and transferred to the uterus. IVF, therefore, completely avoids the fallopian tubes, so blockages don't matter. However, research has found that an inflamed tube does significantly decrease the odds of IVF success. If you have a hydrosalpinx fluid-filled tube, your doctor may recommend surgery to remove the tube. Thereafter, IVF can be tried upon recovery. If you are intending for family planning, kindly contact United Medical for assistance. Please visit our site www.unitedmedical.sg for more information on Singapore fertility treatment.